from Bumrungrad Hospital Talks. I am your host, Dr. Laura, Doctor of Pharmacy, and in today's episode we will talk about the extremely interesting medical technology, robotic surgeries. Robots have been working in the manufacturing industry since the 1950s, but their entry into the medical field was not until the 1990s, along with a demand for minimally invasive surgery. Since then, the growth of the robotics industry and the artificial intelligence technology have driven advances in robotic surgery. And I am honored to introduce our expert, clinical professor Dr. Anusak Yiengpruksawan. Dr. Anusak graduated from medical school in Japan and did his fellowship in surgical oncology in the United States. He has extensive experience in cancer surgery and has incorporated minimally invasive surgery into his practice. Dr. Anusak considered one of the pioneers in robotic surgery and has taught, presented, and performed live surgeries both nationally and internationally. Thank you, Dr. Anusak, for spending your time with us today.
Thank you, Laura. I'm happy to be here. And thank you, listener, for being here too.
And I would love to ask you more about your professional experience.
Okay, I think I should start right back when I was, in Japan. I went to Japan to study medicine after high school in Thailand under the auspices of the Japanese government. It was called the Mombusho Fellowship Scholarship Program at that time. After finished medical school, then I spent another 5 years doing research and clinical training in thoracic surgery and GI oncology. And then I went to the States. I did additional fellowship in surgical oncology at Memorial Sloan Kettering Cancer Center.
Oh, wow.
And after that, well, it's a long kind of training, period for me. After that, I went to Brooklyn, New York Methodist Hospital to become the director of surgical oncology there. I spent another 5 years there, and then I moved to the Valley Hospital in New Jersey, just really across the river. There, I became the director of surgical oncology and minimal invasive surgery. We didn't have robotic at that time. That was in 1995.
Wow.
Yeah. I did a lot of cancer surgery, mostly in open fashion, up to around 1990 when I switched to laparoscopic surgery. But again, I applied that only to a simple operation because my kind of cases were too complex for laparoscopic surgery. Then at Valley Hospital around 2000, we got the robot.
Oh, what was the first robot there?
Well, it's our hospital is probably one of the first two in New Jersey that purchased the robotic system. It happened because one of our cardiac surgeons who loved toy and he wanted to have the robot to play. So what happened is that he donated his money to the hospital and have the hospital bought the system for him to use. But because his volume was low and many of his cases are really not indicated for robotic surgery, so he asked us, the general surgeon, to go for training. So 13 of us went, and out 13, only I survived and continued to use robot.
Oh, that's amazing, doctor. So this is probably then your first time actually saw the robot, right? Mm-hmm. So how did you feel about that, your first experience?
Well, I was quite skeptical about it because I thought it was just a gimmick, the idea of using that kind of, I would say immature technology at that time to apply to the kind of surgery that I was doing, which was very complex, In my mind, it was just not possible. But then when I went for the training, as soon as I sat in the console, or what we call control center, and start moving the manipulators, it just like a lightning, hit me, or something popped in my head. I really see the potential at that time that maybe I could use this robot to apply to some of my surgery that I couldn't do at that time with laparoscopic. And so that's my first impression of that robot. So when I came back, I started recruiting the patient. The first case was, of course, very simple one, was a gallbladder cholecystectomy.
Was it total one? Did you remove totally?
Yeah, totally. And, the patient was 92 years old.
Oh, okay.
And, he was very in good health. He was still playing golf. So when I told him that I'm going to use robot to operate on him, he was kind of confused a little bit. Then I was explained to him. I was very honest about it. I said, this you'll be my first, but I can assure you that I'm quite confident about doing cholecystectomy. If something happened that I couldn't continue with robotic, I would make sure that you're safe, and I would proceed to perform a laparoscopic on you. And he just smiled and said, okay, go ahead.
Okay, so this was your plan B, right? If it does not work, you can do laparoscopic with that, right?
And it went very well. Fortunately, we spent not even 40 minutes to complete the procedure. So it gave me sort of encouragement to continue. And after that, we start putting more and more difficult cases in. By the end of the year, we did about 14 cases. The last case was a distal pancreatectomy, which was really a kind of challenging procedure at that time.
Of course, because it was the first, probably, types of robots, right, to use. And was it Da Vinci, right? Or was it
it was a Da Vinci, yes.
Mm-hmm.
There was a competitor at that time called the Zeus, which was a little different platform. It's not that easy to use. So that one basically, I guess, went out of business or bought by and absorbed into this Intuitive Surgical Inc., which is a company producing making this Da Vinci.
Oh, okay.
Yeah. Mm-hmm.
But right now, is it any alternatives to Da Vinci, or it's only one?
Well, there's still there are competitors now from UK and also from Germany, Japan as well, and also I heard Korea. But their technology level is not really up to the Da Vinci yet, because Da Vinci, have a long history. It's already 20 years, and they put a lot of money into the R&D, research and development. So they're really far ahead of the peer.
And a lot of data as well already available.
Yeah.
All right. So,
what does a robot-assisted surgery procedure look like?
Well, some people might think that it's like autonomous, robot, meaning the robot just do everything, or robot just does everything on its own. But actually it's not. It's still controlled by the surgeon. You have the robot that's designed to function like a human surgeon, standing by the patient, doing the actual operation, but the movement and everything is controlled by a surgeon who sits about maybe 2 meters away at the control center. So just imagine, I'm not sure if you've seen the movie Transformer.
Yes, of course.
Yeah, where the operator, humans, sit inside the head of the robot.
Yeah, and operates.
And then manipulate it.
Yeah.
So basically, whatever action you make, the robot would imitate that.
Yep.
So basically, this is what it is.
The same thing.
Yeah.
All
so
right.
it's human control procedure, basically.
So so the question is like, I think a lot of your patients have this question, like how they can trust this robot because this robot does everything. But as you said, it's not the robot, it's the surgeon who controls everything.
Right.
What's going
right.
during operation.
And there are very excellent safety mechanism built into the robot. So if there is any kind of malfunction, it's automatically stopped right then and there. So you can't really move. It can't make a mistake by moving on its own either. So that's
so
a good point.
So this is let's talk a little bit about advantages. So what are the advantages of the Da Vinci robotic surgical system?
Well, robotic surgery basically is a minimal invasive surgery, just like laparoscopic surgery. The instrument and the camera goes through the small incision. So they're both basically the same if you look at the incision size. The difference is inside how the system works. In laparoscopic surgery, as you know, the instrument is very clumsy. It doesn't allow you to perform complex operation. And the vision that you get is two-dimensional, and you have to look away from the site where you do surgery. You have to look at the monitor, which plays opposite you or somewhere else in two-dimension. And you know, in two-dimension, you really don't get the depth perception. So sometimes when you're working in the deep location, you might not be able to really predict where it is. So it's kind of clumsy before you really finally get to it. And to do complex procedure in the depth of, let's say in pelvis, it is very difficult. On the other hand, robotic allow that kind of procedure to be done very smoothly because the instrument is designed to almost like a human's hand. It has wrist. And the camera also provides the three-dimensional image for you. So you perceive both the depth and you can manipulate your instruments almost like you have your hand inside. So everything can be done very fluidly and smoothly. Plus, because this is a computer system, so the movement or the image can be digitalized and transformed. The image can be magnified into, I think, 3 times, so you can see much, much better and clearer. The movement from the surgeon, the sort of undesirable motion can be filtered, through the computer. For example, if the surgeon have tremors, the tremor would be filtered out. So you see the action in the robot arms would be completely different from the action in the surgeon's side because you won't see that tremor with the robot.
So it will be very precise.
Right. And then the other thing is the computer is able to scale down the surgeon's motion to allow the robot to perform a really fine procedure. For example, surgeon move in the regular movement. That movement would be scaled down to 1/3. So the robot would perform in a much, much more finer.
Like gently.
Yes. So so basically you can do your surgery with robot in a much clearer environment and also in a very natural hand movement action as well. So let's say cancer surgery, which is very important to make sure that you clear the margin, that you don't cut into the tumor. With robot, you can do much more precise and better control than laparoscopic. So it has a lot of advantages compared to laparoscopy in that fashion. It makes the procedure much more precise, much more controlled, and of course that translates into better outcomes for the patient.
This is. How about complications after surgery? Is it any rates if you compare to laparoscopic?
Well, of course, complications do exist, but we have many studies. Let's say looking at the procedure for colon or for gallbladder. Although statistically they're not really that different between laparoscopic and robotic, provided both procedures are performed by really experienced, surgeons. But there is a little nuance in there. If you were a surgeon, you use robot, you could see the problem before you really get into it. And if there's a problem, you can repair, you can fix it much better with the robot. And that's sometimes you can't really quantify it. So that's basically the quality of the robot that perceived by the surgeons themselves. Once you become very proficient in robotic procedure, in robotic skills, it's very difficult for you to go back to laparoscopic again. As you can see nowadays, in Thailand, the robotic prostatectomies become very commonplace right now. And if you ask any urologist if they want to go back to use laparoscopic to perform prostatectomy, I would say none of them would say yes.
Wow, this is interesting. But you were talking about surgeons' experience as well. So it's very important to be very well trained in robotics in these particular surgeries to be able to perform the surgeries, right?
Definitely, it's just like any kind of skilled procedure. Surgeon has to have a good background. Of course, in surgery you have to really know your stuff, anatomy, physiology first of all, and then of course you have to be trained in a correct fashion. We have school for that. We have a training, the facility for it, and the next important thing is you have to have experience. That means you have to have volume, because it's just like art. You can be a good painter if you paint more pictures, and people who really paint only one or two.
You mean the number of cases?
Right, number of cases really also very important.
This is for patients to check. So this is the question the patient should ask the surgeon. Definitely. How many cases did you perform for the last year?
Yes. Volume and outcomes are pretty correlated.
Oh, this is great. Let's talk, because you were talking a little bit about surgery performed on prostate, on pelvis. So can you tell me what exact conditions can surgeons use robotic-assisted surgery for?
Well, nowadays the Da Vinci can be used for almost anything from the oral cavity all the way to the rectum. Not to mention something in the chest, for example, lung surgery, esophageal surgery, or in the abdomen. In the abdomen, we can apply the robot to almost every organs nowadays. I guess in Thailand, the most popular organ the surgeon used to remove or operate on is prostate and bladder, kidney, for example. But in my area, I use it for pancreas, stomach, spleen, adrenal gland, so forth and so on. Anything you can imagine, basically, we can do it now.
This is just amazing, to be honest. And we were talking about benefits, right? So robotic-assisted surgery already a little bit. But as you said, it's a better outcome and the more precise.
Yeah, you can divide into the benefits to the patient and benefits to the surgeon.
Okay.
So benefits to the patients, of course, it's a minimal invasive surgery, just like laparoscopic surgery. So the patient have less pain and recover faster, and less complications, say from less bleeding, for example. For the surgeon, that's completely, really different between laparoscopic and robotic. From the ergonomic point of view, in laparoscopic, surgeons really basically operate in a very unnatural, uncomfortable position. If you do laparoscopic surgery for more than 3 or 4 hours, you're going to get stiff neck, stiff shoulder.
Because I have to look at the monitor, right?
Yeah,
okay.
and the instruments also doesn't allow you to move in a natural way. Whereas in robotic surgery, you sit at the console, you look down, so much just like you perform a natural operation like in the traditional open surgery. So you're much more comfortable, you're much more relaxed, and you perform the surgery in a natural way, so it won't really injure your neck or injure your arms. And the thing I like most about the Da Vinci is that when you sit at the console, you look down at the monitor, you feel like you are in your own world. You have a really very deep concentration. You are not distracted by anything outside, because the only thing you see is really what inside the patient and what you are doing. So that's really the big advantage as far as I'm concerned.
Oh, wow, that's very interesting. And very interesting question. Robotics has changed modern medicine a lot, just in general, right? However, what do you think about the future of robots in surgery? Would they be able to totally replace a human one day?
Well, that's an interesting question to explore. I think because, as I mentioned before, the robotic surgical system is a really computer-enhanced system. So if you have computer involved, you know that it's going to continue to progress. So the potential of robotic surgery is unlimited, as far as can see. Just imagine in the past, you started with the typewriter, and then you move on to word processor, which is computer platform. And then because it's digital, so all other digital information can be added to that. So you got sound in it, so you get pictures, so now you get an iPad or you get an iPhone.
Sure.
So the thing's going to happen in similar way to the robotic surgery. Right now, we already have image incorporated into it. So in the future, especially in the field of cancer surgery, you have a lot more technology involved. For example, you can really use technology that allow you to identify the cancer while you're operating, exactly where it is, even in the lymph nodes, for example. So that's one direction that I think is going. And the other direction, of course, is you're talking about artificial intelligence.
Yep.
And that's going to be integrated into it. So right now, certain simple procedure that's with a simple algorithm can be done by the robot itself. You just feed in the program and the robot will perform that. But in the future, I guess once the computer powers, increase more than nowadays, we'll be able to do a more complex operation. I mean, of course, by robot, not by human. The other thing that I see is that the miniaturization, meaning the robot itself would be smaller and smaller, up to nanoscale, where we can inject that robot into the body, and the treatment will be at the cellular or molecular level, and that's already being done in the lab.
Yeah, I heard about that. It's they're robots, and they actually deliver medication cancer medication to the cancer cells.
Sure.
I just read it like a few months ago. Quite successful.
Yes.
So we'll see. This is the next step.
That's
Yeah, that's a technology, and if we're talking about, let's remember, then we watched, for example, Terminator, the movies, and it was is the future we might never see. But what happened now, we can see the robots which made by the Boston Dynamics, and all of them, they're like real living things. So
that's something you have to really be, I guess, concerned, especially with artificial intelligence, and especially nowadays, the Da Vinci basically is almost like a network. It can communicate with one another. So, but I think that that Terminator-like movie probably won't happen in the real life. I hope so.
I hope so. All right. And you know what? I recently learned then you offer a free consultation regarding robotic-assisted surgery to patients. I think it's such a great offer. Can you please tell us a little bit more about that?
Well, I came to Bumrungrad this year to basically help restart the robotic surgery program here, which actually was started early in 2018, but it has serviced mainly the urology patient. So this time what we're going to do is we're going to expand it into other specialties as well, including general surgery, thoracic surgery, gynecology, and also ENT. So I think patient or general populations may not really understand why so many applications for robotic surgeries. So to answer your question, why I offer this free consultation is because I don't think it's a good idea for the patients or family to seek information through social media or from someone who have no knowledge of this area to give opinions or suggestion. So I decided to initiate this free consultation service for the patient and the family. Let's say if they're recommended to have robotic surgery and they're concerned about it or have questions, they can always consult us, and we'll give them a very unbiased answers and also evidence-based information. Okay.
All right. And this was absolutely great session, Dr. Anusak. Thank you very much.
Also, I would like to encourage our audience to do not miss this fantastic offer and send your request to Dr. Anusak through Bumrungrad Robotic Surgery Center, or you can send your email to international@bumrungrad.com as well. You can see this email in the description of this episode. Or simply you can go to Bumrungrad Hospital website, bumrungrad.com, and send your inquiry. But please do mention that you're seeking a consultation with Dr. Anusak regarding robotic surgery.
Dr. Anusak, what exact papers the patient should send?
Well, if they have the clinical information, lab or imaging report, if they have imaging itself, that they can send, that would be much more preferable than just a report, paper report.
Okay. Thank you very much, doctor. That's quite clear. And thank you everyone for your attention. This is Dr. Laura and Dr. Anusak from Bumrungrad Hospital Talks. Please subscribe to our podcast for more episodes. Stay safe and healthy.
Thank you, Laura, and thank you, every listener. Bye.
Bye-bye.